Our student panelists who will talk a little bit more in detail about their projects. They have been selected after many rounds of listening by experts and stakeholders, and have earned their position here to talk a little more in detail about the work and what inspired them to take it, which is of very big importance in itself. What triggered them to do what they did. First, I would like to invite Aaryani and Kashish.
Can you believe that 1 in 4 adolescents suffer from diagnosable mental illnesses? That's 288 million people across the globe suffering right now. But almost 90% of them will never reach out for help because of the stigma around mental health. Hi everyone, my name is Kashish.
And I'm Aaryani.
And together, we founded Project Let's Talk, an initiative that aims to start a conversation around mental health through awareness sessions.
Our journey began in 8th grade when we saw our friends struggling. Every time we encouraged them to reach out, they refused. This was painful for us to watch, and when we talked to them about it, we noticed a common pattern: the presence of stigma. They were too ashamed of what they were going through to ask for help. And that's when we knew that we wanted to work on mental health. Because this isn't just the story of our friends. This is the story of millions around the world.
Thankfully, through 1M1B, we got the opportunity to do something about this. We conducted around 100 consumer interviews where 87% of our interviewees refused to reach out for help while going through something because of the fear of being judged. For us, this confirmed that the problem was the lack of awareness and the stigma surrounding the topic of mental health.
Using our findings, we decided that awareness sessions would be the best way to tackle this issue.
We wanted to work primarily with teenagers, as changing mindsets and prevention are both much more effective at a younger age. Our aim was to create a safe space for teenagers to reach out for help and talk about what they have been through and what they are going through.
After our sessions, the children approached us and shared their experiences. It was heartening to see when Savita, a student in one of our sessions, told us that now she would try to express her feelings more frequently and even ask her friends to do the same. This validated that our project was making an impact.
In the past 6 weeks, we've conducted 13 awareness sessions in 5 schools and 1 orphanage across Bangalore. We have an outreach of over 1,200 students, and almost 1,090 of them said they were more likely to reach out for help and talk about their feelings after attending our session. We also have 4 student-led clubs launching, run by our volunteers.
We have over 80 volunteers who we are training to do the sessions themselves so we can have a scalable and sustainable model of our project.
We've launched our website, heyletstalk.in, where you can download our content, take it to your local school, and conduct a session yourself.
Right now, as we speak, there are children thinking of harming themselves. As we speak,
there is a child who has lost all hope and doesn't want to go on anymore.
There are kids who want help but are too ashamed to ask for it. You can change this. Join us, and together let's create a world in which individuals can reach out for help without the fear of being judged.
Together, let's make a difference in people's lives.
Together, let's talk.
Thank you, Aaryani and Kashish. David, I would like to come to you. And so Aaryani and Kashish here have really touched upon an issue which is rampant but very rarely addressed in a mass scale. And there are statistics which show that mental illnesses are on a staggering high. I would like to have one quick comment from you on this, and if you have any comments or questions specifically for what they just discussed about their work.
Thank you. Great passion for this issue, and you've really struck on an issue that is so widespread, not just in India, but in my role covering much of the world and especially much of Asia, staggering across almost every country in the region. So it's very, very important. I think using technology and people, combining those things to get to scale sounds like a good way forward. And I would encourage you or ask about as your plans for capturing your impact as you start working with a wider and wider group of volunteering, so that you can then be telling your story to more and more people and growing. Do you have any thoughts about that?
So we have a website launching, and since we have so many volunteers, a lot of them are really passionate about this because they themselves have gone through things. So what we're doing through our platforms is we're sharing their stories. We have an anonymous platform on our website in which individuals can share their stories and connect with other people anonymously, so we can, really create a safe space for them.
Fantastic. I think if you can keep that passion and capture those impact stories and data, then your funders and your supporters are going to be knocking on your door.
Thank you.
Thanks.
Sure. Thank you. Aaryani Kashish, great presentation. I wanted to tell you a couple of things. Before I joined MasterCard, I spent 2 years as Chief of Staff to the U.S. Surgeon General, who's the highest physician in this country, leads public health policy for the United States government. The number one topic that we chose to focus on was the stigma around mental health. And the reason why he picked this is because, like me, like you, he is of Indian origin. He grew up in India, and he thought about the stigma and the reasons why we don't talk about it. So I think your plan is a good one. I think your efforts to start the conversation, to make it a comfortable one. But I also want you to think about what are the root causes for why that stigma exists. When I was growing up, my grandmother was schizophrenic, and I was told at a very young age not to share that publicly because it could affect my marriage prospects. It could affect the quality of professional life I had. It could affect all the things I wanted to do with my life because people would look down on our family. So while my family might have been supportive of my grandmother, it wasn't that they looked down on her, it was that they were always nervous about a societal reaction. So as you sort of tackle this messaging problem that you have to deal with in your society, the question you need to ask yourself is, what is the values-based message that's going to bring people together? What are the compelling stories that's going to make it relatable to every household, because we all deal with this? And the third is, who are the right messengers? And here's where I think you should partner with some of the other people who spoke about their presentations, the work with the elderly, the mentorship program in the schools, the efforts to tackle stigma around mental health. These are all related. Because if you can find champions in the community, if you can find credible messengers, it will help you scale this project much, much faster.
Thank you. Tony, I'll come back to you. Yeah. Tony, I'll come back to you after the next presentation because we're slightly behind schedule. Because the next set of presenters, I would like to mix both the presentation and consolidate that into one question to you. So the next